Hammer toes are when the toes kind of start to curl up like this, the lesser toes, so toes 2 through 5. And so there can be a lot of reasons for that. They can be associated with bunions. So when that big toe starts to crowd some of the lesser toes, sometimes they'll start to get some hammer toes. It can also be due to muscle and tendon imbalance, so weakness within the muscles actually within the foot. So in foot and ankle, we have both intrinsic and extrinsic muscles. Intrinsic muscles would be the muscles within the foot that actually cause some of those motions, and then the extrinsics are the muscles that are up in the leg that are controlling motion within the foot and the ankle. And so when they get intrinsic weakness, they can start to get some of that because the stronger muscles will always overpower the weaker muscles. So as you start to get weakness, you can start to get some of that. A lot of times it's due to tight calf muscles again. Because you'll start to recruit the tendons that pull the foot up and pull the toes up to try to combat that tight calf muscle. And so you can start to get some hammer toes in that situation. So if they're still flexible, meaning in the office, I can still correct the toe and get it straight, then we can usually do some tendon transfer. So we take a tendon from the bottom of the toe, transfer it to the top of the toe so that you're not having it pulled down anymore. And so it leaves you with a toe that is straight, but kind of just has motion at the metatarsophalangeal joint. If they're rigid, meaning in the office, I can't get them corrected, or if they've progressed to a point where you're starting to have dislocations of your metatarsophalangeal joint, then a lot of times we have to shorten the toe and then put a screw across it and fuse it. So we don't fuse it at the knuckle where like the ball of your foot is, but we'll fuse the toe so that it's straight, so that it no longer rests in that position. Patients don't like it because the top of the toe will rub on shoes, the tip of the toe can rub on the ground, and they can get calluses and sores, and it can be painful because of that.